Hello, my name is Ruben Martin, and this is my informative speech on concussions. There are more than 300,000 sport-related brain injuries a year. Most of the injuries are concussions. A concussion is a traumatic brain injury that alters the way the brain functions. In most cases, concussions that are suffered are minor and most people recover without long-term effects. However, some concussions can be very severe and life-threatening. Almost all concussions happen from a hit or blow to the head, but they can also happen from a violent shake or whiplash. Concussions are a very common injury, especially in contact sports. There are several different tests to determine if someone has one and how severe it is. Concussions have a variety of different symptoms that range from minor to major. The most common symptoms are headaches, drowsiness, and feeling spacey, but other symptoms include memory loss, nausea, vomiting, and a lack of concept of time. These are all standard symptoms of concussions. However, there are major symptoms that can take place and immediate medical attention should be sought after if they occur. These include changes in alertness, convulsions, muscle weakness on one or both sides, persistent confusion, repeated vomiting, unequal pupils, unusual eye movement, and liquid flowing from the eyes, mouth, or ears. The severities of the symptoms determine the grade of the concussion that is sustained. There are 5 grades of concussions that determine the severity of the injury. The first is a grade 0, which is actually a non-concussion. The reason for a grade 0 is to be able to diagnose someone who was tested for a concussion but shows no signs of one. The next level is a grade 1. A grade 1 concussion represents a minor injury to the brain. In a grade 1, the effects of the concussion last for a minimal amount of time and the person injured does not lose consciousness. The next 2 grades are the grade 2 and grade 3. These levels are moderate and the effects last for a longer period of time. In these stages, a person might have lost consciousness. The final grade is a grade 4 concussion and is the most severe. Almost all the time when someone suffers from a grade 4 concussion, they have been unconscious. Grade 4 concussion effects last the longest and can keep an athlete out of practice for a long time. Different tests are used to determine if a concussion still exists in a person and how severe it is. The tests that are most used are physical tests like eye tracking and balance tests. Another common form of testing is questioning. Questions are asked in order to determine a person's memory. The questions might consist of what is your name, how old are you, where are you, do you know what happened, and what is the first question I asked you. Although these tests are the most common, machine tests can also be used to determine the severity of the injury. The machine test can be an EEG, a CT scan, or an MRI of the head. Regardless of the test or symptoms, if someone has a concussion, the recovery and treatment is all the same. The only way to heal a concussion is time. The only thing the severity of the injury changes is the amount of time needed to fully heal. The time can range from a couple of days to weeks. Regardless of the grade, no athlete should return to practice until they are clear of all symptoms for a full 72 hours, and then they should start easing back into practice. Many sport organizations are taking precautions such as protective gear and rules in order to prevent the concussions from happening, but nothing has been able to stop them. Concussions are a growing concern for athletes, and a way to prevent them from happening must be found.